Okay, so this is going to be my last video, I promise, for today. I'm done with my day, and before I go home, I wanted to kind of close the loop on our discussion about the mortality, the death rates associated with each one of the coronaviruses that we've talked about. You remember back in 2002, we had dealt with SARS, and I had told you that it's about a 10% mortality rate. Well, the total number of cases that we know of that happened with SARS was 8,437, out of which there were documented 813 deaths. That results in a case fatality rate. That's what CFR stands for. CFR is the technical epidemiologic term for determining death rates, not in the general population, but amongst those that are infected. That's by definition what a case fatality rate is. So the case fatality rate, and that's what we've been talking about the entire time, is 10% for SARS. For MERS, there was 2,494 cases, out of which 858 died, so roughly 30%, maybe even a little bit higher than that. And now, look what's happened with COVID-19. COVID-19 so far, this is the latest data that I was able to grab, was that there are documented 1,083,084 cases and a documented 58,243 deaths. And that roughly works out to about a 5% confirmed fatality rate, or case fatality rate. I've underlined that because I'll tell you why I think that's in flux, because we're talking in real time, and as the amount of testing gets ramped up, and keep in mind, the United States now is the #1 country in the world for new cases. As the number of cases that are diagnosed increases, that CFR, or case fatality rate, will go down to what I think is a more reasonable number of 1 to 3%, and it could be conceivable that at some point it'll become even lower. Now, so even though we've talked about how bad SARS was and how bad MERS was, and how COVID, even if we take the data as it stands right now, its kill rate is only 5% compared to 30% and 10%. But yet, we have to reconcile ourselves with this number. We've got 1 million cases, and as a result, we've got 58,243 deaths, astronomically more than what the other two agents caused. So what's the give? What's the issue here? Well, in order to understand what's happening, we have to look at a little bit of epidemiology. And I'm not an epidemiologist. My intention in this video is not to turn you into an epidemiologist, but to give you a working framework for how to make sense of the fact that something that apparently doesn't kill a lot of people can still end up killing 58,243 people as of today. And for that, you need to have familiarity with something else. And that something else is called the R0. And that is the reproductive rate, or the infectivity rate of a particular agent. So, if we were to look at the reproduction rate, let's just say it equals 1, just so that you have a framework. An R0 value of 1 means that for every infected individual, under those circumstances that they have in a particular point in time, their likelihood of passing it on to one more person. That's the most reasonable if they have an R0 of 1. So 1 to 1. As a general rule, epidemics and pandemics don't occur if the R0 value is 1 or less. That's an important framework to keep in mind. So, what do you think the R0 value of COVID-19 is? Well, this is the secret sauce that's resulting in all this carnage. Its R0 value is about 2.2. So that for every one person that is infected with COVID-19, he or she is likely to infect another 2.2. That's why the social isolation becomes so important. Now, look at this. SARS, the R0 value was 0.5, dramatically less than 1. And although we're not 100% sure on the MERS, but the chances are really good that it's somewhere around 0.3. So even though they were both far more lethal than COVID-19, the reason why these numbers look paltry compared to what we're dealing with in 2019 and 2020 is because of the R0 value. And this is what's important to understand about a virus, or for that matter, any infectious agent. They have to have what I call an inside game and an outside game, just like basketball players. So if you look at the really, really great basketball players, they always have the outside shot, but they can also take the ball to the hoop, they can get into the paint, and they can also do damage there. Well, if I could use that analogy, these two versions of the coronavirus family, they had a great inside game. If they got you, chances were really good that they're going to kill you. Remember the 10% fatality rate and the 30% fatality rate. What these two lacked is their outside game, which is their infectivity, their ability to reproduce. Now, when you look at COVID-19, even though its inside game is pretty weak, it infects a bunch of people and doesn't kill that many, relatively speaking, percentage-wise, but it's its ability to infect so many people, the outside game, that makes it so dangerous. Now, I want you to imagine for a moment a scenario, which would really be a doomsday scenario, of a virus that could come along that has an R0 value somewhere around 2.2 or God forbid even higher, but then has the mortality, the case fatality rates similar to either SARS or MERS. That would be a Holocaust like none ever seen before on planet Earth. So, in understanding how it is that certain viruses end up causing more harm than other, you have to know what their kill rate is, something we measure in something called case fatality rate, but that has to also be considered or weighed along with their R0 value, which is their reproductive value or their infectivity. And that's how COVID-19, in a very morbid kind of way, won the race here, is that although it wasn't as fatal, it wasn't as lethal, its R0 value, which is 2.2 versus the 0.3 or the 0.5, is so much higher, its infectivity is so much higher that it's caused all of the devastation that it's causing. Now, one thing I want to emphasize about the R0 value, this is not a fixed number. So as our efforts to socially isolate from one another increases, our ability to test and therefore monitor people that are infected or at high risk for infection, that will decrease the R0. So the R0 number is very variable in time, and it will improve hopefully with the measures that we're imposing.